Hello and welcome to the Pharmacy Informatics Professor 2020 with your host, Dr. Armin Simonian. If you've been watching the news over the last few years, you've noticed that there's been a change in the face of retail pharmacy. And what are the clues? What have you seen in the events in the news that have pointed to this? Let's go back to 2018 when Amazon bought a company called PillPack, which is basically an online pharmacy that involved prepacking patients' medications into individual, or let's call unit doses, placing them in a box and then shipping them out to the patient. This is a growth of online pharmacy, and with e-prescribing and delivery and remote telepharmacy or telecommunications with the patient, prescriptions can be filled and refilled with patient counseling occurring over the telephone or in a video conference. In 2020, late in 2020, United Health jumped in as a competitor to PillPack and acquired a company called Dividos, which basically was a similar business of an online pharmacy. And this is the trend that I saw in the news of where things were going with retail pharmacy. So the traditional drugstore or chain store, independent, whatever the situation might be, patients going to the pharmacy with a written prescription and getting that filled, waiting for the prescription or coming back, or even getting deliveries directly from the retail establishment. Those days have changed. And now we see where we're going to more online ordering, prescribing, fulfillment, and delivery. The other things I've noticed is that with the pandemic, obviously, we had to change the way that we did business in our pharmacy. So we need to have social distancing and masking. And it's a little bit more of a challenge for the patient to come into the pharmacy and fill a prescription. And so I noticed that drive-through pharmacies became a lot more popular now. And the preferred method, if the patient is actually going to the pharmacy, they can remain in their car and get the prescription filled in the drive-through methodology. And thirdly, if you look at where things have been going with vaccinations and the whole discussion of frontline workers, I was disappointed at the beginning of the pandemic when doctors and nurses were constantly cited as the frontline heroes who were providing health care to the newly diagnosed COVID patients. And there was no mention of pharmacy, even though we were greatly involved both in the acute care and retail settings. And that changed when the vaccines became available and people started realizing that this is what pharmacists have been doing all along. And just this year, in 2021, there was a directive by the new president to start shipping vaccine doses directly to the major chains and having the vaccinations, a concerted effort, a lead effort done by the pharmacists in the chain pharmacies. So as you can see, things have really changed. I think that public opinion and the view of the pharmacy has changed from the old drugstore model to something newer where we're kind of the face of vaccination. And there's also services being provided online as everything has gone virtual, as everything has gone online. We're seeing more of that trend happening within pharmacy too. So another example of watching the news, seeing pharmacy informatics in the news. So these are direct pharmacy informatics applications where you have e-prescribing, you have unit dosing of medications occurring, you have telepharmacy involved. A lot of the topics that we've talked about in all of our episodes about pharmacy informatics, these come together when you look at the trend of where things are going with retail pharmacy. I hope you found this interesting, and if you have any comments, you can place them alongside this video. If you found the discussion interesting, then please like the video and subscribe to my channel. And I will thank you for that. In the meantime, stay safe, stay healthy, look after the health of others, and I'll continue to work on more episodes and watch the news and give you some more clues about where pharmacy and pharmacy informatics is going based on what's happening in world events. Take care.